Yes, absolutely. The recent Harris poll showed that men are significantly more comfortable speaking about sexual health than their female counterparts, which was actually quite surprising because, in general, women do a better job than we do as far as bringing health related concerns to the attention of their doctor. Now, despite the fact that men may be more comfortable, they might not necessarily have all the information that they need. It appears that they're well aware of the medications, probably from direct-to-consumer marketing, but they're not aware of the options when medications fail, which they do in up to 50% of men. And they may also not be aware that this is such a common problem, as the majority of men past the age of 40 will have some changes that may lead to issues in terms of their intimate life. The other thing that I would encourage men to ask their physicians is what other factors could be at play here, whether it be diet, lifestyle, or we're increasingly aware that a change in sexual function may be the first warning sign of conditions such as diabetes, high blood pressure, and heart disease.
When I was diagnosed with ED in my early 60s on there, it was an embarrassing situation for me. It was difficult for me to communicate with my wife that I had an ED problem on there, but lately, or after that, I wound up being connected with Dr. Terlecki, and he allowed me to have a full line of communication with him, and that helped me with my ED problem and solution with my wife.
So the treatments are various, and so the first line of treatment is to address anything that's correctable in terms of the patient's diet, lifestyle, or other health-related issues. Beyond that, first-line therapy typically involves oral medications, but when those fail, options include injections, something known as the vacuum device, or a completely internal option known as the implant that Steve was alluding to. This is completely concealed, looks natural, feels natural, and allows both people to enjoy sexual activity just as they did in the past. And over 500,000 men have gone on to receive this therapy.
I had tried several different options on there, especially the oral medications, and I did not like the side effects on there from that. And also, after a period of a couple years, they were ineffective in solving my ED problem. In 2009, I attended a patient seminar and found out about the positive results of the implant surgery and how it affected men's life with their partners and wives. So therefore, I immediately told Dr. Terlecki I wanted to have the procedure. And it was one of the best decisions I've ever made in my life as far as having a healthy marriage. Also on there, I would like to say that any man that's experiencing an ED problem should discuss the problem with their physician, and between the two of them, they can come up with a viable option that will solve their ED problem. The implant for me was the way to go, and I am thankful that I had it done.
For more information, you can go to edcure.org, that's edcure.org, and that's a resource developed and maintained by Boston Scientific, with whom we partnered today.